She tolerated the treatment position very well, so she laid on that foam for 5 minutes. And can you tell us now?
I feel great.
You feel great?
Yeah.
Tell me more.
No pain. Not sore anymore. It's not hurting. Feeling great.
And what did it feel like when you walked, right after when you got up from the table?
That felt really good. Because before I couldn't even get up from the bed and walk.
Very good.
Yeah.
Alrighty, well, let's have you lie on your stomach.
Okay.
You know, in the next few days, you might notice that you feel freer somewhere else in your body.
Okay.
You might not.
Okay.
But take note if you do, because I'd really like to know.
Okay.
All right, so PSIS is right here.
Right.
So I'm going to spring the sacrum. I can now load it.
Right.
And I can spring it, and I see your feet move. So the force goes through the SI, into the hip, into the leg.
Okay.
Now, I'm springing the ilium in the plane of the joint. So I push and it gives. Comes to a stop, and then I spring it. And it springs forward and it recoils. And now I'm going to look at the ligament. And you know what? It feels tighter to me. And now I'm going to spring it. And it bounces right back. Do you feel that bouncing?
Yes.
Yeah. So it's a distinct feel. You know, blocked motion is a very distinct feeling.
Right.
And here's sacrospinous and that bounces. So yeah, when I find blocked motion, it feels like I'm pushing against a block of granite.
Right.
And when it gives, it feels like I'm testing the shock absorber on my truck. I load the fender to a stop point. Then I do a thrust and it springs down a little bit more. It compresses, but then it bounces right back. And I keep the load on that structure so that when I'm done doing the spring recoil test, then when I let go, there's an additional recoil that shows me I kept the slack taken up in the system. So I'm very curious to see how you do over the next few days. You already know how to self-treat this.
Right.
Okay. So I would like you to do this self-treatment every day for 5 minutes. So do it this evening.
Okay.
And let's do it for 3 days in a row.
Okay.
If while you're doing it, it starts to get a little sore or something, just stop.
Okay.
Okay? You know, I think at this stage, 2 minutes is plenty of time, but see what you can do.
Sure.
Keep me in the loop.
Okay.
We'll schedule you back, you know, in a few days or next week.
Okay.
And this is such a rare injury. And in my notes, one of my considerations was to refer you to rheumatology, being concerned that maybe you have, you know, an inflamed SI from, you know, a rheumatological condition.
Right.
An example would be ankylosing spondylitis. That's no longer on my concern list.
Okay.
Okay. And the other consideration was to refer you to pain management for injections to those sensory nerves.
Right.
But I think this was mechanical.
Okay.
And I'm just grateful that I was able to identify it, being that I haven't seen one in probably 10 years. There's probably more out there that are just not being diagnosed, and probably some of them end up getting a fusion.
Right.
You know, there's an awful lot of marketing for SI fusions, but such a unique case, and I really appreciate you letting me film this. Thanks.
Thank you.
Yep.